Let's answer this NCLEX practice question together. The nurse is caring for a 27-year-old patient with a right arm cast for fracture of the humerus. The client told the nurse that he hasn't been able to move the fingers on his right hand since this morning. Which of the following actions is important for the nurse to take first? Whenever you read questions like this, it is important that you find the key word. Once you are able to identify the keyword, you understand the keyword, then you connect that with your nursing content. That's going to help you to identify what the correct answer is. Now, in this case, we have a client that has a fracture of the humerus. So it's important that you understand what fracture is. And you also need to take note of the fact that he has a cast in place. All of these will help you to identify the correct answer. So he has a fracture. Here is what that looks like. Fracture is a break in the bone that can occur from a trauma, or it can result from a fall. It can also result from a bone disorder. There will be pain and tenderness over the area of the trauma. And then you also need to make sure that you remember there could be complications. One of the complications of fracture is impairment of circulation, and that can lead to tissue death and nerve injury. That's very important, and that makes sense because there is a reason you need to take an action. So when we take a look at all of the information that we have, the symptoms suggest neurologic injury that can be caused by pressure on the nerves and the soft tissue around the area. So it is important for you as a nurse to assess for all the symptoms of neurovascular compromise so that you can report that to the healthcare provider. In answer choice A, rubbing on the fingers will not help to fix what the problem is. Giving analgesic in answer choice C is also not going to relieve the problem. Plus, the client is not complaining of pain. In answer choice D, is talking about a dressing change. There is no need for a dressing change because the client has a cast in place. So when you look at answer choice B, check neurovascular status of the extremity. That will make sense because we need to find other symptoms that is going to indicate neurovascular compromise. That way we can report that to the healthcare provider. And that is the correct answer. So thank you so much for watching. I hope you learned something. If you have any question, you can drop them in the comment section. See you next time.